The children of our society are a very vulnerable population. The numbers on this table emphasize the fact that child abuse and neglect is a problem that needs attention. In 2014 alone, there were more than 700,000 victims of child abuse, with a little over 483,000 of those victims being between the ages of newborn to 9. That is a devastating number. The Child Abuse Prevention and Treatment Act is a policy that greatly focuses on such issues. This policy, originally established back in 1974, has been reauthorized many times, with the most recent being in 2010. I will now be taking an implementation analysis approach to this policy. This policy focuses on the overall well-being of children, which may include, but is not limited to, prevention, protection, assessment, investigation, and treatment. It also mentions requirements of the federal government to help states and communities carry out their plans by sharing knowledge relevant to this issue, to distribute financial resources, and help with promoting or providing professionals to adhere to ending such problems. The term child means a person under the age of 18. The term child abuse and neglect means, and the Act defines it as, any recent act or failure to act on the part of a parent or caretaker which results in death, serious physical or emotional harm, sexual abuse or exploitation, or an act or failure to act which presents an imminent risk of serious harm. The benefits of this policy are mostly service. These types of services are programs such as home visiting, family resource and support centers, or planned and emergency respite care. Respite care provides a place for the child to go when their parent or guardian is in need of assistance with problems such as substance abuse, domestic violence, housing, personal health, or even a job crisis. The Department of Health and Human Services is the main branch of this policy. Most counties have designated representatives who people can get in contact with if need be. This makes it more convenient for everyone to access their services. The faces of this department are very diverse, showing respect for every individual and making it so that there is no barrier to access. There are also many offices within this department, such as the Office of Child Abuse and Neglect. The issue here is that with exceptions of donations, most services dealing with child abuse and neglect are federally funded, which means that it will mostly come out of taxes. In this sense, we are all paying for these services whether we want to or not. But on another note, at least the money is going to a good cause. Now, take a look at this from a social justice framework standpoint. There are many things to take into consideration. A child needs adequate attention and nutrition in order to mentally and physically develop correctly. A child also deserves to be raised in a home where they can feel safe and not have to worry whether there will be food on the table tomorrow. Protected by the Constitution, parents have a right to raise their children as they choose, and each parent should be given equal opportunity to do so. But parents do have a legal obligation to protect their child's safety and well-being also. If parents cannot meet this obligation, whether it be intentional or unintentional, the state has the right to do whatever is needed to protect that child. Social workers should do more with primary prevention. This would include things such as public education activities, parent education classes, family support programs, and many more. If there is more focus on preventing abuse and neglect from the beginning, the outcome will be substantial. I would suggest mandatory parent education with also informing parents of places to go within their community if ever in need of assistance. These activities are executed before any child becomes a victim, but I do believe that if parents are more informed and required to be informed on what constitutes a child abuse or neglect, prevention techniques, services available, and consequences coincided with such incidents, that child victims definitely will drop.